Ahead on the Smart Life, what you need to know about prostate cancer. Does it always need to be treated?
Great question, and we have the answer for you. Then, you know how annoying dry eyes can be? It's so bothersome.
That's right.
We're going to show you what you can do about it.
Plus, how to stop enabling your loved one who is struggling with an addiction.
And you've heard of a hydrofacial. We're going to see what it is and what it can do, and if it can just take off all my wrinkles.
What wrinkles?
All of them.
That's coming up next on the Smart Life.
Hi, everyone. Welcome to the Smart Life, coming to you from the Baptist Health South Florida studios. I'm Olga Villaverde.
And I'm Derek Lata. Aside from skin cancer, prostate cancer is the most common cancer among men.
In fact, according to the CDC, it's a leading cause of cancer death among men of all races and Hispanic origin populations.
And joining us to discuss this is Dr. Daniel Martinez, a urologist with Baptist Health South Florida. Welcome to Smart Life, doctor.
Thanks for having me.
Thanks for being here.
Here's an interesting stat. Most men don't get screened or checked out.
That's so true.
We know better. How come? Why don't we do it?
Well, because we're men. I think it's the extra testosterone
That's
in
the
our
greatest
bodies.
answer I've heard so far.
The extra testosterone in our bodies makes us do a lot of really dumb things.
Exactly, and that's why you marry wonderful wives that tell you, honey, go get checked.
That's right.
Right?
That's 100% correct. And the bottom line is this. Although prostate cancer is the most common cancer that we as men get, second to skin cancer, as you said, and yes, you can die from this, it really comes down to, if you get screened, it has a very high survival rate.
It's really like in the 90s, right?
Correct. It all depends, of course, on different things. But yes, you know, it's almost to the point where I tell men, when I have to give them that terrible news, nobody ever wants to hear the C word, right? Cancer. But when I tell them, look, sir, you have prostate cancer, the first thing I say right after that is, don't think of this as a death sentence.
Right.
Think of this as somebody telling you have diabetes. Okay, nobody ever wants to inject insulin, but guess what? You do it.
And you can live.
Of course, you live your life perfectly fine. That's correct. So it shouldn't be that, hey, I'm scared, I don't want to know because I'm scared. No, you want to know because it's something very treatable.
But let me ask you this. Okay, because I mean, certainly I'm a woman, so I don't have to worry about this. But is the fear because you hear the C word or because of where it's occurring and the man is worried about impotence?
Yes, correct.
What, did you like that question?
As a man, I like that.
Was that PC?
Very nice, PC. Well, a lot of men, when we talk, is they don't want to know because if they have to go through an operation, that's the end of the sex life.
Yes, that's a great point.
It's a double whammy.
Well, so here's what I say. And I do general urology, but my subfield, I actually did a fellowship in what I say, bringing the dead back to life. So my fellowship is actually sexual medicine. So when I get a guy comes to me and says, doc, you know, I don't want to get treated because I'd rather live my life being able to have intercourse and dying at an earlier age than treating a cancer and then not being able to have intercourse.
What do you say to that?
Bottom line, what I tell them all the time, you will have sex until the day you die.
Exactly.
So number one, the treatments have gotten very good. And most men that come out of some sort of therapy, whether it be radiation or some sort of surgery, have great erections. And number two, if you do develop some erectile dysfunction, we have so much to offer.
Fix it, of course, but you want to live? Oh my goodness.
Absolutely.
Doctor, I'd like to ask you a favor if you don't mind, because I want to educate our viewers.
Sure.
Could you maybe look at this graph for us? It is the prostate, and tell me exactly what we're looking at. Obviously we know, because we're talking about the prostate, but just kind of like chime us in on the anatomy 101.
So this is what we call the lower urinary tract, okay? So waist down. From the top to bottom, you have the big circular thing that's kind of pinkish reddish. That's the bladder. The two tubular structures coming in are the ureters, or the tubes that connect kidney to the bladder. And you can see a little hole on the sides where they come in. The little, it looks like a seashell to me, right on the base behind it, those are the seminal vesicles. Then you have the acorn-looking thing, which is the prostate, and we got a little cheat sheet there, a little black dot with the name prostate. And then the thing going right to the middle of it is the urethra. And you know, one of the things that guys always ask me, well, what is the use of the prostate? Is this just this vestigial organ that is meant to just cause issues like the appendix? You know, appendix we don't really use it, and people get appendicitis. Well, the prostate's actually an incredibly important organ. We could not procreate without our prostates. When a man ejaculates, 80% come from the prostate and seminal vesicles. So those two parts, the seashell and the acorn, that I saw over there. That's the part that produces 80% of the ejaculate. It's the fuel. It's what helps. It allows the sperm to do its job when a man is trying to procreate and have intercourse.
It's like the vehicle. It helps the sperm do its job and get to where it needs to go.
Correct. But yes, unfortunately, at younger ages, it serves its purpose. Not to say men are having children well within their older ages. Not to say that a 40, 50-year-old isn't old, but I've seen guys as old as 60s, 70s, and they want to continue to have children. But as we get older, it can cause some issues. It grows and causes some obstructive issues, lower urinary tract issues, voiding issues, and yes, it can get cancer as well.
In that graphic, is that a healthy looking prostate, what we saw there?
I don't know. I think it's, I don't know, that's Roger Rabbit's prostate or what. That's kind of a cartoon, so. Doesn't really look that way, so.
I don't know.
But I think so.
I mean, is that an alarm?
I think it's yours, Derek.
I'd have to do, yeah. I'd have to do a rectal exam on the TV to see if it's.
I don't think that's real. I think that's just a little caricature.
Is it swollen or something?
Yeah. So to give you an idea, actually, it really is a normal size prostate, about the size of an acorn. Okay. So we call it 30 grams, which, if you look at that picture, it looks a little bit bigger to me than when you compare it to the actual bladder. So.
But not to scale.
Normally, when men age, I don't know if this is correct to say, and obviously you correct me if I'm wrong, but when they get to the 70s, 80s, 90s, most of them get this?
Sure. So as we age, when I say we men, somewhere around our 40s was when we start to see the effects of benign growth. Okay, the joke is as we get older, the prostate gets bigger and the penis gets smaller. That's the joke. But it's actually, there's some truth to it.
I can see it.
And yes, as we age, let's say if we had a room filled with 90-year-old men and we cut out all their prostates, we wouldn't do that, of course, but if we did, and we chopped all their prostates up, we're going to find an incredible amount of these men with some focus of prostate cancer. We see that in autopsies.
But some develop and obviously some don't.
Most guys, especially as they get older, and that's why screening now, we don't really screen older gentlemen, especially if they're not very healthy, because even if they have prostate cancer, the treatments can be riskier than the benefits. And so it usually doesn't do much. It takes a long time to cause issues. So the rule of thumb is about, depending on your prostate cancer, of course, because not all prostate cancer is the same, about 10 years if you decide to do anything, that's really when it starts to cause issues and can take your life. So it's a very common thing, and every man, if you live old enough, probably develop a focus of prostate cancer.
At what age should they start?
That's a great question. Great question. A few years ago, we were much more aggressive with prostate cancer screening. And ultimately what happened was the AUA came in and changed that after the U.S. Preventive Task Force came around and said, listen, we need to improve this. So family history, you start at 40. No family history, 45.
Okay.
Then you do every year rectal exam with a PSA, which is blood work.
How fun.
Yeah, absolutely. And then 75, usually more or less 70, 75, depending on comorbidities and the patient's lifespan, that's usually when you stop.
But you know what? If we can do a mammogram, if we can do a pap smear, guys can do this. It could save your life. Easy, one and done.
Sure.
Great stuff. Thank you so much, Doctor.
Thank you so much for having me.
Thanks for the fun, too.
Thank you so much for having me, guys.
Really appreciate it. More Smart Life after this.
This young mother of 3 didn't think much about her subtle symptoms.
The symptoms I had were really much like symptoms of a hemorrhoid or other really pretty benign conditions.
Annie was 36 with no family history of colorectal cancers. Even her doctors wanted to take a wait-and-see approach. But then Annie read an article of 2 people her age who had been diagnosed with stage 4 colorectal cancer and had died.
That scared me. I have 3 kids and it's not worth the gamble.
So Annie scheduled a colonoscopy. Her diagnosis? Rectal cancer. Dr. Scott Steele of the Cleveland Clinic believed Annie would be a good candidate for the TATME, which stands for transanal total mesorectal excision.
What TATME allows us to basically do is to take those toughest cancers, the cancers in patients who have those that are closest to the anus or big cancers, and allows us to get them out and still reestablish the bowel continuity.
Which means that the patient will have an overall speedy recovery, lower risk of complications, and will have no need for a permanent colostomy bag. For Annie, that option made a huge difference to her quality of life.
It's a real gift to have the opportunity to not have that permanent alteration to your body.
I'm Marty Salt reporting.
Straight ahead on the Smart Life, we'll see why your eyes can get so dry. You gotta see it to believe it.
You're watching The Smart Life on the Health Channel on South Florida PBS. If you'd like to learn more, please visit the Smart Life page on our website at allhealthtv.com. If you have a question for our experts, please visit the Ask the Experts page or give us a call at 855-796-4475.
Don't forget to download the Health Channel app. It's available free at the App Store or on Google Play. Follow us on social media at All Health TV on Facebook, Instagram, and Twitter.